Care This Week Santa Clarita at Home Care Services and the SCV Community Health Resource Center. Home Care This Week was talking to Genine Chambers, an LA independent insurance agent. Genine shared with us about the different kinds of Medicare options, both medical and prescription care plans, what an agent is for, and why you need one to help you navigate getting the right plan. Medical and prescription coverage is only good if you have it before you need it.
So I am with Genine Chambers. She's an independent insurance agent who markets Medicare products. And we're going to talk a little bit about Medicare, and particularly some problems or thoughts that people would have that are getting to that age, or maybe they have loved ones, seniors that are getting to that age where they need to start considering this. And it's a big, broad, confusing issue.
Alphabet soup.
Right. So tell us about some of the options, some of the things that people would be looking at and considering in that kind of question.
Okay, as far as the types of things that people would consider when going into Medicare is you want to consider whether or not your doctor is going to be, first of all, is the doctor that you're currently seeing really important to you? Mm-hmm. If they're really important to you, then you need to make sure they're part of the plan. Mm-hmm. And that doctor, by the way, doesn't have to necessarily be your primary care physician, also known as a PCP. It could be a specialist. I mean, I've had people that have come to me and said, you know what, I had a heart attack. My cardiologist is so important to me. They're critical to my life. I feel like I owe my life to them. I won't go into any plan that doesn't have that cardiologist on it. So sometimes it's a cardiologist, sometimes it's the family practitioner.
And can they keep that cardiologist?
It depends on which plan they pick. Okay, and that's one of the first questions I ask them. Is there a doctor that is extremely important to you? Okay. And if the answer is yes, then we take that into consideration. If they say no, like for example, the other day I had a gentleman who said, you know what, he said, I just moved here from New York a few months ago. I don't have any allegiance to any doctor. Mm-hmm. Okay, great, so you're open.
So now is it cheaper? Is it easier if you don't have an allegiance to a specific doctor, or is that, what is the difference?
Well, if you don't have an allegiance to a specific doctor, then you have more options. Okay. That's really what it boils down to. Okay. If you have an allegiance to a doctor, then you have to either go with a med-sup, which would allow you to see, also known as a medi-gap policy, which would allow you to see any doctor that accepts Medicare, or you have to find your doctor in a Medicare Advantage plan that has him as part of the network.
Okay, so you're kind of narrowing or widening your options based on that, but you can. I mean, the point is that it's not that it's all or nothing. It's just looking at and kind of narrowing your plans, your options there. So what do? Is that something that you're help somebody kind of figure that out? I would imagine that these plans are just real simple, laid out like this, that there's a lot to it and a lot to consider back and forth. What do you do with people and kind of thinking that through?
And basically what I do when somebody comes to me and they're getting ready to go on to Medicare, what I do is I sit down with them and I explain to them Medicare, mm-hmm. What I call Medicare 101. Medicare 101 is basically explaining to them that how soon can they sign up for original Medicare Parts A and Part B?
How soon is that?
You can actually sign up 3 months prior to your birthday month. So, for example, if your birthday were sometime in April, that would mean as of January 1st, mm-hmm. you could sign up for Parts A and Part B.
Okay, for your birthday, which birthday?
Your 65th birthday.
Okay. Like any birthday. 65th or so there's this kind of lag here. It's not just the right after your 65th birthday, but it's
3 months prior. The 3 previous months are the window that you can sign up. And again, using that example of an April birthday, your effective date would be April 1st.
Okay.
You got that?
Well, I got it, hopefully, but that's a lot of things that people, when they're looking at this, okay, so I get that there is it's not cut and dry here. There's some time frames here and dates that are different, but that's kind of what you do of helping, okay, let's stop and look at this. When is your birthday? What are all these things, right?
Yes, exactly. What doctors are important to you. And then, of course, the real big one also is drugs. I mean, let's face it, drugs are very expensive. I mean, you hear about it in the news like crazy right now. Drugs that are going up, what is it, 400%, 5,000%. I mean, it's crazy the stuff
So
you're
it's
hearing.
the panic is, okay, now what happens with that, right? I'm on all these prescriptions, et cetera.
So I have to take that list of drugs, put them into an analysis, and run them through the different plans and try to determine, first we have to determine, are we looking at a Medicare Advantage plan? Or are we looking at a Medicare supplement and a prescription drug plan?
Is that part of the decision-making process
Yes.
of which one to go?
Yes.
So you're looking at doctors, you're looking at the prescriptions and the drugs, et cetera, and so those are kind of part of the package.
Correct.
And then you put them through a process and say, okay, based on all these factors.
I would recommend, well, or what I'll say is, pros and cons of going this route, med-sup plus a drug plan is this, and the pros and cons of going through a Medicare Advantage plan are this.
Very good.
Which way are you leaning more towards? And I'll typically tell them too, based on what you're telling me, this doctor's really important to you, they're not part of the Medicare Advantage plan, so you might want to consider, if you can afford it, the med-sup. If that's not, then we need to make some trade-offs. Sometimes that's what it is. Sometimes it's not black and white. Sometimes it's so clear that they should be on a Medicare Advantage plan, and other times it's 50-50.
Right. So
And then sometimes it's a dollars and
this thing.
cents type of analysis of, can you afford the premiums that come with a Medicare Advantage plan, or also known as a medi-gap.
is there anything that someone should be doing prior to all this that kind of helps that process? Before this happens and before you're qualified and you can get on Medicare, is there something, I should be doing this, or I should be helping my mom or dad go through this?
There's a booklet that's put out by the government. You can actually see it electronically on the internet. It's called Medicare and You. And it's a great primer.
It's free?
It is free. It is, I don't even know how many pages it is, but it's a nice, simple to understand, very in layman's terms. It's a great place to start. So I definitely recommend that people go through that so they at least have some base knowledge.
Got it. That's not going to necessarily take the place of somebody that should. Now, your role in this so you're effectively a broker there that says, okay, and am I paying you? How's that work?
I'm glad you asked. As far as payment is concerned, I'm not an hourly employee with any company. I'm an independent agent, which means that I only get paid if I help somebody to find the right plan. Now, let me take that a step further. I'm not there to just sign you up or sell you something and walk away. My goal is to have a long-term relationship with you, because every month that premium is paid, the insurance company will pay me a commission.
So they're paying you through the insurance company.
Correct.
As opposed to writing you a check to help me do this.
Correct. So
Okay.
the individual who comes to me for help and assistance, it doesn't cost them anything more than if they went directly to the exchange or to the insurance company or anything like that. It costs them nothing more. They just have an additional advocate
Gotcha.
to help them cut through the minutia.
Now, yeah, exactly. So we're here in Santa Clarita. Now, let's say my mom is in Florida, right? Do we use somebody like you in Florida? Can we use you? Is it what would be the optimum thing to do in that situation?
As an agent, I'm licensed in the state of California.
I see. Okay.
There are agents that are licensed in multiple states. I've chosen to stick closer to home.
So, yeah, right. So that's great. Good to know. So then if my mom is in Florida and I want to, she's getting to that age and and she needs to kind of figure all this out and do exactly what it is if she was here. So I would be looking, and why would it be important for me to find somebody like you in Florida or anywhere here? What is it that's important, better having you do this rather than just do it on our own?
Well, as I said, it's another advocate. As an agent, we have some back doors that we can get into the insurance companies to talk to them. We know where to go to find the answers quickly, rather than you spending hours and days trying to find the answer. And, you know, a good agent will make sure that they get their answers from the people that are knowledgeable and that are going to give them the right answers.
How could I find that agent in another state?
Well, that's something that you need to either go through the insurance company or, like, if, for example, if I were recommending, I had somebody moving out of state and they needed some assistance, I have an organization that I would use and ask for a referral for another agent in another state, because this company that I work with is nationwide, so they would be my resource. I use them a lot for, like, marketing reasons, knowledge base.
And you'd feel more confident and comfortable with somebody that's, as opposed to just off the street kind of thing.
Absolutely.
Gotcha. Okay.
Absolutely.
So if there was one thing that you would say to somebody who is approaching this age, or has a family member or somebody that's approaching the age to start factoring this in and start considering Medicare, what would you say to them? What would be the one thing that, you know, you would advise?
The one thing I would advise is don't wait. A lot of people, they wait, and they wait to the point that they end up with penalties. For example, the one thing I've seen, and it's always so sad when I have to give them the news, is that they did not sign up for a drug plan because they didn't take drugs. And why am I going to pay for insurance for something that I'm not going to use? You know,
Right.
I've heard those words or something similar. And, you know, then they find out 10 years later, oh my gosh, I've got drugs now, I need a drug plan. Well, unfortunately, there's a penalty that's tacked on to their monthly premium, and that's through the government. So it's not the insurance company, that's
Right.
the government is enforcing it, and that will follow them for the rest of their lives.
So this is like any insurance, right? This is not something where that's what it is insurance.
It
and
is.
just like anything else, you don't get insurance after you have the car accident.
True.
You get the insurance before, which is exactly the kind of thing here, where, okay, I don't need the drug plan right now, but the odds are you're going to.
The thing is, too, is that if you, unfortunately, like I said, it's with car insurance, if you don't have car insurance, you don't have a penalty for not having car insurance. You know what I mean? There's not like a percentage that's added on to your insurance because you didn't have it for 6 months, so you're gonna pay extra because you neglected to have insurance. We don't have that. Whereas with Medicare, you do. At least with the drug plans.
Gotcha.
And you can have either a standalone drug plan to meet that criteria, or you can have a Medicare Advantage plan to meet that criteria, or you can be on like a group plan. So you know there are different things that can fill that need.
Perfect. All right. How could we get a hold of you?
You can call me.
What number?
My phone number is 818-458-4377.
Great.
That is my cell phone, so yes, I do work weekends and nights. I get asked that a lot.
Yeah. Just like all of us in these industries, in the healthcare industry, there's no 9 to 5. Because people get hurt, get sick, whatever it is, anytime, any day.
Exactly. When I'm not working, I don't answer the phone.
Thank you, Genine. Thanks for coming in.
My pleasure.
Thank you, Genine, for coming to our show this week. If you need more information on Medicare, please contact Genine Chambers by calling 818-458-4377. Coming events in Santa Clarita for the next week are Wednesday the 23rd from 1 to 2, the Senior Center will be hosting a lecture, How to Get Better Sleep. Don't we all need that? Thursday, both the Senior Center and Atria Senior Living will be hosting their very own Thanksgiving feasts. The Senior Center will be having theirs at 10 a.m. Atria will be having theirs at 4:30. At the SCV Community Health Resource Center on Tuesday, the 22nd at 6 p.m., we will be hosting an Alzheimer's Association speaker series, Effective Communication Strategies. Learn to decode the verbal and behavioral messages delivered by someone with dementia and Alzheimer's, and identify strategies to help you connect and communicate at each stage of the disease. That's all for this week. We hope that you have a fantastic Thanksgiving and enjoy it with your friends and family. Thank you for this week.